Hi, I'm Dr. West, and welcome to Finesse Plastic Surgery. I've been in practice now for about 10 years in Orange County, and during that time, I've had the privilege to take care of thousands of patients. I think what makes our practice different than most is the time that we'll spend with our patients trying to figure out what the right surgery is for them. Our consultations last about an hour. So what happens during the consultation for revision surgery? It starts with figuring out what your goals are for revision. There's a whole host of reasons why people come in who've had implants in years ago and want to do something different. One of the issues that we see a lot is issues with implant position. So over time, implants tend to drop down or they'll drop out to the side. Sometimes it happens to one breast, sometimes it happens to both. So it's fairly straightforward to go in and reposition an implant. In some cases, we use sutures to do that. In other cases, we use grafts. But the idea is to get the implants to sit in a great position so that when you lay down, they don't fall out to the side, or when you're standing up, they don't drop too far down, making your nipples look high. So there's a number of ways that we can improve the overall implant position. Typically, we do that in the setting of taking out your existing implants and placing new implants. In some circumstances, we can sometimes look at using the same implants. Another common reason people seek us out for revision surgery is for capsular contracture. So over time, there's a scar tissue that's going to form around the implant, and that scar tissue can become quite tight and it can squeeze the breast, making it feel firm. If you leave it alone too long, it can actually drive the breast up high on your chest and make it look fairly deformed. And if you continue to ignore it, it can actually cause pain. So the way we treat that is to take out the implant, release or remove the scar tissue, and place a new implant. At that time, you can decide, do you want the same size implant, smaller or bigger? It's one of the many things that we'll go over. One of the other common issues that people seek us out for revision is to deal with ruptured implants. People find ruptured implants usually when they go to get a mammogram or an MRI. In terms of the treatment, fairly straightforward. We remove the implant. The question is, do we do that with the entire scar capsule called an en bloc capsulectomy, or do we leave the scar tissue in place? For ruptured saline, we usually leave the capsule alone. For ruptured silicone implants, sometimes it's cleaner to take out the implant and all the scar tissue. Either way, the goal will be to make the breast pocket clean and start with a fresh implant. Another common reason that people seek us out for revision is for size changes. Some people over time decide that their implants are too small. Sometimes they decide that they're too large. Size change can be straightforward or it can be kind of complicated. In general, it's easy to increase the pocket size to accommodate a bigger implant. It can be a little bit more challenging to downsize, so then the question becomes, how much of a change are you looking for? If it's a substantial size change, we're usually having to do a breast lift at the same time to take up the extra skin that you have when you go to a smaller implant. One of the other things that we commonly do for revisions is fat transfer, or what people will call fat grafting. So people will sometimes get a contour irregularity where they like most of the breast shape, but there might be an indentation in one small place or a couple places. What we can use is a liposuction technique where we take fat, usually from the belly, but we can take it really from anywhere. We'll process that fat and then we inject the fat into the tissue to camouflage some contour irregularity. It's usually a pretty quick procedure and you get a bit of a twofer out of it because the breasts look better and then the area that we treat with liposuction also looks better. So that's sort of the full complement of the type of revisions that we do. The best thing that we would suggest is, if you're concerned about your existing implants, come in, walk us through what you're trying to achieve. We can walk you through the various options and figure out the right plan for you. We hope to see you soon.